Peroneal subluxations are not common injuries, but they can occur, especially with athletes as they get older. Just a little background to kind of reacquaint yourself with the perineal. Your perineals work eccentrically to prevent inversion of the ankle. They aren't really strong everters. Their job is more to prevent that eversion from occurring. They are anatomically held in place by that superior and inferior perineal retinacula. So what will happen is you may notice a sudden reflexive contraction of the perineal muscles either during an acute inversion injury to the dorsiflexed ankle or during a forced dorsiflexion of the everted foot. And this is going to occur when people step off the edge of a curb or onto someone else's foot. Signs and symptoms are going to include posterior lateral ankle edema. The person is going to complain of a snapping sensation. The pain is localized to the posterior lateral malleolus. They will have pain during active dorsiflexion, during eversion of the ankle, or circumduction of the foot, and they're also going to have pain during push-off. Range of motion is going to be within normal limits, although you may get that snapping of the perineal during that range of motion, especially plantar and dorsiflexion. Manual muscle tests normally are not performed, although you may do inversion and eversion testing, but it's usually, unless it's right after the injury, the person is going to be fairly strong. Diagnosis is going to be through an x-ray. Oftentimes you may see a small avulsion fracture off the lateral malleolus. This is termed a flick, which is pretty indicative of the peroneal subluxation taking place. Treatment-wise, the most common thing that could be done is a repair. There are 5 basic categories of repair. They may have an anatomical reattachment of retinaculum taking place. There's a bone block procedure that can happen. They may go in and create a reinforcement of the superior peroneal retinaculum. They may reroute the peroneal longus posterior to the calcaneal fibular ligament, or they may actually deepen the groove that the peroneals lie in distal to the lateral malleolus. Padding might also be placed there at the lateral malleolus, just distal to the lateral malleolus, to hold the peroneals in place and prevent them from subluxing during motion.